Seguro que han oído ustedes hablar en los últimos meses.
I'm sure that you have heard much about cannabis in the media, and we've been talking about medical cannabis for long, and we would like to know about what's the clinical evidence and the regulation in Spain on that. To look onto medical cannabis, and we will do so with Elena Gallardo, with Medical Affairs Manager at Pentalium Pharma.
Inmunología. Elena, doctora Gallardo, bienvenida.
Muchas gracias.
Welcome.
Gracias por acompañarnos. Y permítete, ya que está nuestra querida paciente voluntaria, un aplauso para Marisa, por favor.
And a round of applause for Marisa Ibarra.
Bueno, Elena, doctora Gallardo, pónganos al día, actualicemos.
So, give us a quick heads up on medical cannabis.
Bueno, buenos días a todos. La verdad que es un placer volver a la casa OAFI.
Thank you very much, and pleasure being back here. And I'd like to thank OAFI once more and Dr. Vergés for inviting me to share this knowledge on a topic, and I know it's controversial, and I think it's positive to shed some light and to think properly on what medical cannabis is, what's the clinical evidence on it, and what's the regulatory framework here in Spain. On medical cannabis, on the plant as such, we need to consider cannabis sativa as a plant with a very complex chemical entity with different ingredients, as we know the active ingredients, because they have a pharmacological activity, and amongst them the cannabinoids, the terpenes, the alkaloids, the flavonoids. But basically, we focus, as we will be doing in this presentation, on the cannabinoids. The cannabinoids group is made up of up to 150 different types of molecules, and these are molecules that are characterized and typified, but only a few of them have been thoroughly researched. Now, what happens? Some of them, specifically the THC, the tetrahydrocannabinol, is a cannabinoid with psychoactive effects, so an impact on the central nervous system. And so this has contributed this controversy to the cannabis sativa, commonly known as marijuana. And marijuana and hemp are different ways of naming the same thing, but it depends on the way you grow the plant, and depending on that, based on that, you have a greater or lesser expression of this type of molecules. So, THC, and this is the responsible for the psychotropic effect, and therefore responsible for this entertainment, this recreational value that it's used for. But then there are some others that have a safe profile, a healthy profile. And here I would like to focus on cannabidiol, better known for this acronym CBD. I'll be referring therefore to the CBD, and we'll be talking about its secure profile because it has no psychoactive effects, therefore no impact on the activities of the central nervous system. What's the mechanism of action of CBD? Well, this is the endocannabinoid system, and this is an intercellular mechanism of communication that it's not well known. When we talk about the communication system, we may know about the cardiovascular system, the digestive system. Well, there is this ancestral system, the endocannabinoid system, which is all over our bodies and with the CB1 and CB2 receptors. CB1 receptors are the ones that target the central nervous system activity, whereas CB2 receptors have an inflammatory capability. They will modulate the inflammatory response. And these are, roughly speaking, in all of our organisms. For instance, the ones regulating the bone activity or the muscle and bone activity, the pancreas, the liver. So this is an interesting system that will allow for the improvement of certain physiological functions in our bodies. But I would like to now focus on the activity of the central nervous system and the inflammatory activity. These receptors trigger a type of molecules we have in our bodies that are the endocannabinoids. These are endogenous molecules that we already have in our body that will modulate and model the activity of these receptors. Indeed, cannabis sativa, or the cannabinoids in the plant, have a similar molecule to these molecules that can already be found in our body. And therefore, one could consider that the molecules in the plant can provide for beneficial activity on the endocannabinoid system. Which are the benefits of this? If we look into the CNS, we have several treatment targets that are interesting. Why so? Because we can model cognitive processes such as attention span, memory, basic cognitive processes where apparently these molecules, both the cannabinoids from the plant and the endocannabinoids, may have an active impact on the cerebral cortex. Then the appetite control, we also have the control of the emotions, of stress, by means of the central amygdala, then the basal ganglia, the hippocampus, which is the main area for memory, and the cerebellum for the movement coordination, and then the solitary tract that coordinates vomits and nausea, meaning that there is a wide range of potential targets within our central nervous system and where these plant-based molecules might be of interest. Regarding the immune system, the regulation of the inflammatory response, and when talking about inflammation, you will see later how a series of inflammatory mechanisms are triggered with the intervention of several parts, such as mast cells, or macrophage, or neutrophils. And it is important for these to have later some other processes, and so that eventually the tissue is properly regenerated. So, what's the therapeutical target or aim that these type of cannabinoids may have? So, according to the latest update, right before the summer, as you probably know that this was submitted to the Spanish Parliament, a draft with a series of clinical assumptions, so that after the approval by the Spanish Medication Agency, the mix of CBD and THC, so we will have to balance on the one hand the safe profile for CBD and the psychotropic profile of THC in order to provide an opportunity for these therapeutical targets. We're talking about some sorts of multiple sclerosis or nausea and vomits derived from chemotherapy, the endometriosis pain, the non-cancer and cancer pain, and neuropathic pain. This draft is being now assessed by the Spanish Medication Agency, so that by late this year, hopefully, it will finally be approved, and therefore we will have the final piece of legislation on these matters. And you may wonder, well, what else? What's available in the market? What can we know that's in the market and that may have a treatment role? well, particularly on CBD. And CBD, safe profile because it has no impact on the CNS. Now, CBD can be found in different ways, as an ointment, as an emulsion, as an oil, and so on. So, there is plenty of clinical evidence, and I will now talk about that, where the use of this ingredient is appropriate for inflammatory processes. On the one hand, pain causing, and therefore we're talking here about pain alleviation here, and also where there will be a series of stages where we need to check the symptoms on the midterm, where we need to repair the tissue, and also eventually repairing the functioning of the organ that has been injured or damaged. Now, if we are basing ourselves on the assumption of the active, significant role of CBD on inflammation, how come inflammation? Why inflammation? Well, for years, the inflammation has been considered to be a pathological situation, and anti-inflammatories, the well-known NSAIDs, the non-steroidal anti-inflammatory drugs, were used in order to curb the inflammation. And now we know for some time that CBD is a substance modulating the inflammation. It's not preventing it, but rather modulating it. Why is it important? Because the inflammation is the threshold to see, or the anteroom to a series of stages that will eventually lead to a final recovery of the tissue, where the release of an inflammatory factors need to be made, then unless done in the proper time, in the proper staging, there will be a poor recovery of the tissue with certain harm repeating, and therefore with the chronification of certain conditions. This is why this notion of inflammation is better seen as better to modulate it rather than to prevent it. And so we know that it has an impact on vasodilation, on chemotaxis, on leukocyte recruitment. So we need to have it, and we need to have the patterns that were mostly focused on preventing and to turn it on to modulating. And CBD might be of interest here. Let's look closely at how it might modulate it. First, on pain killing. There is some research proving that CBD works on prostaglandins and on TRPV receptor, which in recent years has been seen as a significant analgesic target. It also improves on the profiles of certain inflammatory markers. And there is some clinical research proving that it improves the levels of certain pre-inflammatory cytokines, such as IL-beta. It decreases the interleukin-6 or interleukin-8. It decreases the alpha necrotic tumoral factors simply by decreasing these inflammatory levels. It also helps in recovering the function. There is a recent paper that has proved that CBD does not act by having an impact on some negative areas. And if we are disrupting the anabolic signaling, we might be losing muscle mass because we are disrupting, for instance, collagen production. Several anti-inflammatories, and here NSAIDs again, have an impact on that, so that the use of these anti-inflammatory drugs has as a handicap that leads into a muscle loss. And there is a recent research proving that CBD has no negative impact onto anabolic signaling. And finally, tissue reparation. If we are looking for the prevention of pain for the patient, but also to help treating the injury, eventually we want to have a tissue recovery and a functional recovery. And there is some research showing the decrease in some of the interleukins might also improve on the chondrocytes, which is the main cell found in the hyaline cartilage. Therefore, these are some interesting data that would show both in clinical and preclinical data the potential for CBD. What else? Just to give you a quick overview for the CBD. Knowing that this is a conference for OA patients, and so we're dealing with osteoarthritis here, and we know that OA has several comorbidities, cardiovascular diseases, high blood pressure, osteoporosis. Well, there is some recent research showing that CBD has a potential to decrease blood pressure by decreasing the inflammation of heart through myocarditis. There is also research showing that it has an active role on the bone system. Basically, in the metabolism of glucose, and therefore a positive role on the bone metabolism. So, after a quick sweep, after a quick scan, we see that CBD has a safe profile, acting through several targets. So, one could talk about the painkiller activity, about the as a modulator for inflammation, antioxidant, cardioprotective, anxiolytic, neuroprotective. Of course, several of them, or several of the research supporting this is not brought here because we don't need that now, but it will depend on the use, on how we take it, whether it's orally, whether it's on the skin, whether it's it depends on the way we take it, and this is what's highly regulated now, and this is what I will be telling you precisely now about what's the present Spanish regulation and what's been the recent changes on that. Medical cannabis is now waiting for the Spanish Medication Agency to be approved based on the suggested draft that tries to solve and to explain all the previous aspects I was mentioning to you. It is worth noticing also that this will always be prescribed by specialists until later this might be brought down to primary care and to general practitioners. But first now by specialists, always through hospital pharmacies, so never community chemists, and always considered as a second line of treatment. So that is when other first-line treatments are not working, this is considered. And also in the case of a serious situation, as I've told you before in the previous examples, which would be the regulation not just on medical cannabis, but here on CBD, knowing that CBD is being now marketed in its topical approach. But let's look at the regulatory framework.
I brought with me a slide from a study carried out with 80 doctors in the specialities of medicine, sport medicine, traumatology, and others. And one of the questions was, do you know about the exclusive use of CBD only through topical use? And a percentage said yes, a different percentage said no. Above all, this data shows that the majority did not know what was behind the regulation of this drug, issuing favorable statements. And now I can say and confirm that CBD today is regulated by this European portal of cosmetics. It's a division of the European Medicines Agency, and everything we have today in formulations, creams, lotions, oils, must be regulated by this authority. In addition, internationally, I can say that the World Health Organization issued a positive statement a few years back, speaking of the safe profile of this ingredient, stating that it did not show any risk for health or any collective risk for society in general. At the same time, I would like to say that the WADA, the acronym of the World Anti-Doping Agency, issued a statement in January 2020 stating for the first time that CBD would be removed from the list of stupefying agents, the list of cannabinoids. It was removed because of its safe use and profile. I would also like to say that in this line of CBD products, and right now the only way that it can be marketed under strict regulation is under the regulation of the European Cosmetic Portal, that is for topical use so far. There is a call to close cooperation with the chemist, the community chemist, that is the ones we find in our districts. It's important for us to know that in order for the product to be in the chemist, and that's already a big endorsement, the fact that the chemist already has that product, it needs to go through an assessment committee by the General Council of the College of the Association of Pharmacologists of our country to issue the necessary parapharmacy code. This is important because I think we should ensure close cooperation between chemists, specialists, scientists, so we can actually provide a safe product. And lastly, the last regulation I would like to comment is this open question. Could it be regulated as a food supplement? The answer today is it is not regulated as a food supplement. We cannot do that yet. We know the situation will change. But the regulatory bodies, the ESAG here in Spain and the EFSA in Europe, have stated that for now they are new novel food ingredients because there is no significant track record yet to be able to declare this product as a non-new ingredient. As a result, it is not possible to regulate them as food supplements yet, but we await changes soon. It is known that the EFSA is assessing a request for use for administration of 130 milligrams of these ingredients for oral use as a food supplement, but right now is in the process of being assessed. So we are awaiting regulation of it soon. Having said that, I have reached the end of my presentation, and I hope I shed more light on the profile, on the safe profile of this ingredient, of these cannabinoids. I hope to have opened up this framework of the endocannabinoid system, and that you can find out more about these targets that are being assessed. We hope that we will be able to provide more light on the matter and reach conclusions soon. Thank you. Thank you, Dr. Gallardo. Please take a seat. I will take a seat here too, because I wouldn't be close to my dear Marisa. How are you, Marisa? I'm fine. I'm glad to hear. As Dr. Gallardo says, this is an OA Congress. You are a patient, you are a volunteer, you have osteoarthritis. I want to know how you are and what issues concern you. I'll come back to that in a minute, but Dr. Gallardo, I have the feeling when we are talking about CBD that there is still a lot to be done, right? A lot to be done. And we will find nice surprises along the way. We have a problem, though, which is regulation. Things move slowly in Spanish, European agencies. The Canadian one is much more open. The American agency is much more open. So this may delay the times, right? But in the end, we'll get there, I think. I'm certain of it. I would say that steps have already been taken, progress has been made, and in recent years, we've already taken great strides. We are close to reaching a much better and broader regulation. I speak to pharmacologists and doctors, and many are interested on this topic. They speak of the benefits of CBD as well. Marisa, how many years have you had with osteoarthritis? Well, many. This means that you've been taking it all, I guess. Yes, I've taken it all. I've tried it all. Thanks to OAFI, now I receive good counsel. But I've taken legal stuff, right? Yes, of course. And you, Marisa, you're fantastic. She's fantastic. Because Marisa faces pain. She says so. In addition to osteoarthritis, she has fibromyalgia. I always thank her for being here because I know how big an effort it is for her to come. But no one would say, when she speaks with affection. How do you do it? Well, first, we need the right attitude. Then we need to know your pain, what you have. You need the right advice as well. You need to be advised, counseled, and guided. And then I can face anything. Yesterday I was going up and down the stairs loads of times, and today I'm not feeling all that well. I feel how my muscles, and I can feel all the aches and pains, but I'm okay. But if I ask you, Marisa, after what Elena just told us about in relation to the use, the topical use, the anti-inflammatory use, the pain-killing use of CBD, have you tried it? I have. And I must say, it's a marvel. And I do not hold shares in any company. I have my friend Carmen here, Carmen Sanchez. And in the Congress held in Madrid, I was not able to go because I had to undergo surgery for a hip prosthesis, and I was in a lot of pain. She called me and she said, "Hey, Marisa, let me tell you, there's something new on the market, something that is working really well. Try it. Ask Dr. Vergés to recommend it." And I always trust Carmen, of course. I tried it. And I must say that it works very well. After all the products that I've tried, this works. And let me say something else. As you well know, Dr. Vergés visits me on Monday evening. Dr. Vergés has samples, and I tell him it hurts here, it hurts there, and Dr. Vergés says, try this one. Or I told him, try this one, because it works well. And it is true, when patients come back, he said to me, this works. If it hurts here, with a little bit of cream, it's enough. You massage it a little bit, and it works perfectly well. After the hip fracture, the other side of the hip hurts. So I say, don't worry. Don't worry, I'll put this ointment, and it goes really well. I recommend it. I have no interest, but I would just like to recommend those with pain that this product works. I didn't know Carmen used it too. She recommended it to me. She said, Marisa, I have a product that works. So the best prescribers are people like Carmen and Marisa, right? Because they are trustworthy. Yes, absolutely. The patient's voice is important. We are in a congress where the voice is given to the patient. I don't know Elena. I only met her this morning. Yeah, we can attest to that. But it is true. It does work. My grandchildren as well. Sometimes they're with their phones. And I said, take this, put it here. And it works. Of course it does. But medical cannabis, one day we'll have to explain that it has little to do with psychoactive substances, but medicine will end up doing combinations under medical prescription, of course, with medical control. THC might be included too, but there is still legend out there, right? I don't want to get you angry. In people who are not asked for the ID card when you go to the nightclub, are you receptive to trying these things? Because a 30-year-old might be very receptive to this. Well, let me say something. With my fibromyalgia, one of the products that would work would be this. This would work for me, for my pain. As you know, I have a master's degree in pain. I have the fibromyalgia pain, the osteoarthritis pain, this and that other pain. In fibromyalgia, we are hoping this product will work in the same way that topical use of this cream works. For the rest, we are waiting for something like it. You need to create bigger posology so that Marisa can use 2 tubes a day. No, with just a little bit, it's enough. Last year, I remember, you came to the other Congress. I went there. There was a nice guy, and he said, "I'll give you a sachet." And I said to him, "What am I going to do with this? With my pain to go up and down the stairs with my hip?" And that guy said, or gave me some more, and I keep it. With very little, it's enough. It's not as if you need to apply it everywhere. Elena, we know how important all of this is, but it is also important for the doctor, the pharmacist, to be like Marisa and Carmen, right? To be prescribers. Will this be more difficult? Are they more open-minded in the world of medicine, the healthcare professionals? Or does this depend on age? It obviously depends on the interest and opening up to new progress. How do you see things? I like that term, open mind, because there is an increasing demand on the part of doctors and pharmacists to be informed. They are asking for more information, for more documentation. I believe they are more open-minded, but we need to provide more information about these concepts and ideas, because there is still this concept of there's going to be a high, it's psychotropic. We just see the headlines, and we need to delve a little bit deeper into it. That's where training and education is important. Obviously, we'll need courses, training, but there's something very important, which is to be willing to be trained, right? To be willing to be informed. And you, Marisa, when you apply your cream, you don't start running, right? It would not be doping, because this is not a doping product. Of course not. So, Marisa, I know you need to go to the hospital. I hope everything goes well. Yes, they are operating my son, but it'll go well. Well, an applause for Marisa and Dr. Gallardo. Thank you so much.